Hello everybody, my name is Phung Tran. I'm a physiotherapist. I've been working as a physiotherapist for almost 20 years now. Today I'm going to talk about self-treatment techniques for coronavirus. Now recently I've seen many videos on the coronavirus. Most of the videos are about how deadly the virus is, how many people get killed, and how many people get infected from the disease. So it puts a lot of fear in people's minds. I haven't seen many videos on the treatment and what you can do to help yourself to survive this virus. According to the World Health Organization, the death rate is about 3.4%. So most people who get this virus will survive. Out of 100, only 3 or 4 will die, and 96 or 97 people will survive. However, in my opinion, a risk of 3.4% is still too much of a risk, especially if you're looking after small little kids or looking after your elderly people, elderly parents, and you want to make sure that you've done everything possible to keep them safe. So in this video, I'm going to share some of the treatment techniques that I would do for myself and my family to make sure that they are safe and get through this virus. Now, before I start, I like to say the disclaimer. Now, the information provided in this video is intended for educational purposes or entertainment purposes only. It is not intended for medical advice. If you have the coronavirus, please seek medical attention. See your doctor, go to the hospital if you need to, and make sure that you are safe. Now, let's say you've just been diagnosed with coronavirus. Now, for most people, if you belong to the 96-97% group, you would have minor symptoms, and then you would recover. So what happens in a worst case scenario? Let's say you are diagnosed with coronavirus. Now, because it's a pandemic, there are thousands of other people who also get the virus. The hospitals are full. All the beds are used up. So also because you've just been diagnosed, so your symptoms are not bad enough, so you're told to go home, have a rest, take some cold and flu medications, isolate yourself, and hopefully your body will heal itself and you recover. Now, since this is a bad case scenario, let's say you go home and your symptoms start to become more severe. So you would get a blocked nose, your sinuses are congested, your eyes, there's a lot of pressure behind the eyes, so your eyes become blurry, you might feel dizziness, you have sore throat, your tonsils are swollen, your throat is swollen, which narrow the airway and restrict the breathing. Your neck muscles are sore, your shoulder muscles are sore, your chest muscles are painful from breathing. Even your back is painful, and your lungs start to make a lot of mucus. So you have a lot of phlegm. So after a few more days, all the symptoms start to become more severe. So your nose is totally blocked, you become more short of breath, you're wheezy in the chest, it's harder to breathe, your muscles become more painful, the breathing muscles become more painful and weaker. When you cough, it would hurt everywhere, and you can't even have a strong cough because your muscles are painful. So at this time, now your body is hurting, you haven't been sleeping well, your muscles hurting everywhere, so all you want to do is lie down. As you lie down and rest, the lungs start to make more mucus and it clog up the lung. The throat remains swollen and painful. The nose is continue to be blocked, and so what happens then? Now, as you are not breathing well, you're having short of breath and wheezing, and your lung is producing more mucus. You are not getting in as much oxygen as your body needs. So what happens when your body cannot get enough oxygen? So when the body cannot get enough oxygen, the heart starts to pump harder and faster, so that increases your blood pressure. And what happens when your blood pressure increases? Now, as your blood pressure increases, when you have higher blood pressure in the lungs, you have more fluid being pushed out into the lungs. That means you have more mucus being released in the lung. So what happens when you have more mucus in the lungs? When you have more mucus, you have less surface area available for gas exchange, so you would have even less oxygen going into your body. Now, what happens when you have even less oxygen in your body and all your muscles, breathing muscle, are exhausted, and you can't even take deeper breath to get in the oxygen. So if your level of oxygen goes down even further, your heart rate increase, the heart start to pump harder and faster, and then you have higher blood pressure. So when you have higher blood pressure in the lungs, it would cause more fluid to be pushed out into the lung. That means your lung will be filled with even more fluid, which in turn makes it harder for your body to get oxygen into your bloodstream. So as you can see, this is a positive feedback mechanism. So as you become, as your lung filled up with fluid, with mucus, and you become harder to breathe, it increases your blood pressure. When you have higher blood pressure, it pushes more fluid into the lungs, and the cycle repeats until your lung is completely filled with fluid, and you can't get enough oxygen into your bloodstream, and one of the organs in your body failed, and then you die. So what if you can avoid all that? What if you can minimize the symptoms and the damages that happen to your body, so that you can extend the time that your body has to heal? So the idea of the treatment is, if you can somehow keep your lungs clear and your body fit enough for maybe 2 weeks, then your body's immune system will take over, and then you would recover and join the 96-97% of the people who recover. So now let's go into a little bit of details on what you can do to help yourself. So let's say you've just been diagnosed with coronavirus, you start getting symptoms. So your nose gets blocked, your sinuses are congested, your throat is sore, your eyes are blurry, you feel dizzy, your neck is hurting, your chest muscles are sore from breathing, your back muscles are hurting. And so at this time, because everything's hurting and it's hard to breathe, you're short of breath and wheezy and tired, all you might want to do is just lie down and rest, and hopefully after a few days your body will recover from this virus. Now, lying down at this time is the worst thing that you can do. If you want to lie down for a long time, that's the worst thing that you can do. So what's wrong with lying down? When you lie down, it will be a lot harder for you to breathe. So let's say I'll just lie down. When I lie down like this, all the internal organs here are pushing upwards. So when my internal organs are pushing up, it's a lot harder for the diaphragm to push down. For me to breathe, if I need to take a deep breath, the diaphragm pushes down to open up the chest wall for me to breathe in deeper. So if you can't take in a deep breath, you can't open up the lungs at the bottom, and you can't move the mucus out. For you to move the mucus out, you need to open up the lung. But normally when you're upright, the heart pumps blood to the head, and then gravity pulls it down. So everything is moving, nothing gets congested. When you're lying down, flat on your back, as the heart pumps the blood to the head, there's no gravity pulling the blood down. So you might have congestion of blood in the head. So if there's a lot of congestion behind the eyes, you get blurry eyes, you get dizziness. If there's congestion behind the sinuses, your sinuses will become congested. A lot of people wake up with blocked sinuses. That's from the congestion in the sinuses. If there's congestion of blood in the brain, it will increase the pressure in the brain, and then you wake up with the biggest migraine ever. Now, the pressure in the brain can sometimes compress the breathing area of the brain, so that even restrict the breathing. At this time, breathing is the most important thing. If you can't breathe, then you go downhill very quickly when you can't get enough oxygen. So, what else can go wrong when you're lying down? Now, when you're lying down, like this, now because the blood is heavy, so most of the blood will stay at the bottom, near your back, and when you breathe in, most of the air will be at the top of the chest. So there is a mismatch of where the blood is and where the air is. So if there is a mismatch, you cannot get a lot of air, a lot of oxygen in your body. So if you cannot get a lot of oxygen, that is bad, because it can increase your blood pressure and cause more mucus to be, or more fluid to be released into your lung, which can make your symptoms deteriorate very quickly. What else can go wrong? So when you're lying down, at this time, because your body is under a lot of stress, a lot of people have vomiting. So when you lie down and you vomit, the vomit can go into your airways, and then you can get choked to death. Sometimes because you are too weak, you can't even cough out the vomit. Some people have acid reflux. So if you have acid reflux when you're lying down and the acid goes into your lungs, it can cause serious damages to your lung, and it can also cause inflammation and even cause choking, and you die. So if you are strong and you can cough, then that's okay. So what happens if you're a little baby and you have to lie down for a long time, or if you're an elderly person and you have to lie down for a long time? Now, if you lie down for a long time and you vomit or you have acid reflux, then that put you at a much higher risk of getting choke, getting vomit into your lungs and your airways. So try and avoid that if you can. So what's the best way to lie down? If you have to lie down, the best way to lie down is at an angle. So when you lie down at an angle like this, if you happen to vomit or have acid reflux, it is less likely to go into your lungs and clog up your lungs. Now when you go into a hospital, you never see anyone lying flat down. You won't always see them at an angle like this. So the reason is if they lie flat down, they might get acid reflux or get choked with their vomit, and then they have a chest infection, and then they die. So in hospital they never lie you flat. So if you have recliner, sleep on a recliner where it's up a bit. During the day, try and sit up if you can. Walk around. When you walk around, it's much easier for you to take in deeper breath, and then you can cough it out. Go outside, get some fresh air, as much fresh air as possible. Okay. Now I've seen some pictures on the internet of coronavirus patients where they were lying flat and they have a mask on. So maybe the medical staff are scared of getting the virus, so they put the mask on the patient who is lying down. So this is the worst thing that you can do if you're looking after someone. So if they're lying flat and they happen to vomit with the mask on, what do you think gonna happen? That's the quickest way for them to die. So avoid that at all costs. So let's say if you have a little baby and you have a mask on and the baby have reflux, they're not strong enough to sit up and remove the mask, and then things just go really bad from there. So avoid that at all costs. Now, what about blocked sinuses and sore throat? Why is that dangerous? Now, when you have congested sinuses, you can't breathe through the nose. When you can't breathe through the nose, you have to breathe through your mouth. When you breathe through your mouth, the throat becomes really dry and painful, and they start to become swollen. When the throat is swollen, that further restrict the airway. So it makes it a lot harder for you to breathe. Your body is already under a lot of stress from having a lot of mucus in the lungs. You don't want to put further stress in your throat. So normally during the day when you're awake, it's not much of a big problem. What happens at night time when you are sleeping and your nose is totally blocked, you can't breathe through your nose and you have to breathe through your mouth. So at night time, if you're sleeping and you're breathing through your mouth, you have to have your mouth open. So when you have your mouth open, sometimes when you go to sleep, the tongue can fall towards the back of the throat and block the airway. So this has happened in people who have sleep apnea and people who snore at night. So if your airway is blocked, you cannot get a lot of oxygen going into your system. So if you can't get a lot of oxygen, your heart rate goes up, your blood pressure goes up, you have more mucus being released into the lungs, and things can start to go downhill very quickly. Now, most people who snoring is the snoring is very dangerous. You can get stroke and heart attack from snoring, because when you're snoring and you cannot, and your airway is blocked and you cannot get into airway is blocked and you cannot get a lot of oxygen, your heart rate goes up, your blood pressure goes up. If that happens every night, if the blood pressure goes up every night, it starts to cause tears in the blood vessels. Over time, one of the blood vessels in the heart can rupture, and then you can have a heart attack. If you have blood vessels in the brain that get ruptured, you have a stroke. Most of the stroke occurs at night time, 3 or 4 o'clock at night. That's when you're snoring and you're not getting enough oxygen in. So it's very important to keep your nose clear so that you can breathe through the nose, and your throat is not swollen, so that it doesn't restrict the airway. And breathing through the nose is also very important. When you breathe through the nose, your body makes nitric oxide, which helps to relax your blood vessels. So nitric oxide is the stuff in Viagra. It helps you relax your blood vessels. If your blood vessel is relaxed, the blood pressure goes down and keeps everything working. If the blood vessels are not relaxed, if it's constricted, your blood pressure goes up, your heart rate goes up, and then you start leaking more fluid into the lung. More fluid means less oxygen going into your body, and then things start going downhill. So keep your nose clear, always breathe through your nose. I will go into details on how to keep your nose and your sinuses clear in a moment. Now, breathing muscles. Why are breathing muscles important? Your main breathing muscles is like the diaphragm and maybe your intercostal muscles for the chest. Now, if your lungs is filled up with mucus, your throat is sore and constricting the airway, you're feeling wheezy and short of breath. So the breathing muscles have to work a lot harder to get some air into your lungs. So it's like you going to the gym 24 hours a day, 7 days a week. The breathing muscles have to work constantly, all the time. So if they work all the time, like all muscles, they get tired. If you go to the gym for a while and you lift heavy weight, you start to get lactic acid build up and your muscles become sore. If you keep on exercising at the gym, you might get cramps in your muscles and eventually you can't lift any weight anymore. The same thing can occur to your breathing muscles. So as your diaphragms become exhausted, as your other breathing muscles become exhausted, you start to use all the other muscles in your body to help with the breathing. So you start using the chest muscles, going to the shoulder, you start using your neck muscles for breathing, and you start using the back muscles to help with the breathing. And at this time, because all the blood is being diverted to the important parts of your body, like the brain and internal organs, there are not a lot of blood being diverted to your muscles, so your muscles having to work more with less blood supply. That means they get exhausted much quickly. What happens when your chest muscles, your shoulders muscles are exhausted? So your shoulders will be painful, like you can't even lift your arm past 90 degrees. The front of the shoulder will be painful, the back of the shoulder will be painful. Your neck will be very tight and painful. It will be very hard for you to even turn your head because they will be so tight. Your back muscles also help with the breathing, so you might wake up and your back is so sore that you just have to bend forward to pick up a toothpick, and your back is so sore and stiff that you can't hardly walk. So as the breathing becomes more restricted, your muscles have to work even harder to get the oxygen in, and because they have to work 24 hours a day, 7 days a week. Eventually, sometimes your muscles can cramp, and that means becomes really sore, that you cannot even take in a deep breath, you cannot even cough. And if you cannot take in a deep breath, you have less oxygen going in. And if you have less oxygen going in, your blood pressure goes up, you have more mucus, and the cycle keep going, and you go downhill. Your breathing muscle needs to be strong enough for you to cough. Now, if your cough is strong, you can move the mucus out. If your cough is weak, then you can't move the mucus out. The mucus build up and you die. So in hospital, we normally check to see if the person is still coughing strong enough. So if you cough if your cough is strong, you can move the mucus out. If your cough is weak, then you go downhill and you may never recover. So how do you make sure that your breathing muscles are not exhausted? So make sure you treat the symptoms as early as possible. So if there's restriction in the airway, you make sure the airway is clear. So if you have say sore throat, you have to make sure the throat is not too swollen so you can breathe in easily. Lying down for a long time is very bad for your breathing muscles because they have to work harder to get the air in. Sitting up, walking around is much easier for your breathing muscles because you can get better oxygen. Now how you breathe can make a lot of difference to your breathing muscles. Let's say if you're breathing really fast like this, you're breathing but you're not getting a lot of air into your lungs and you're putting a lot of stress on your breathing muscles. So normally a healthy person, a fit person would breathe about 6 to 8 breaths per minute. Someone with heart disease might breathe 10 to 12 breaths per minute. Someone with cancer who is badly affected in the final stage might breathe 15 or more breaths per minute. If you are about to die, like if you have serious coronavirus, you'll be breathing like this. A turtle breathes 2 breaths per minute, and a turtle gets to live to 200 years. So the faster you breathe, the quicker you die, let's say. So when you breathe too quickly, you lose a lot of carbon dioxide, and carbon dioxide is important to keep your blood vessels open. If the blood vessels is open, then your blood pressure goes down, and if blood pressure goes down, you don't get more fluid being pushed out into the lungs. So it's important to keep the lungs clear. So how do you do the breathing? So if you can somehow slow down the breathing, you keep your heart more relaxed, you keep your blood vessels more relaxed and open, you keep the blood pressure down, and your muscles are not working, your breathing muscles are not working as much as if you're breathing really fast. So the way to do breathing is like how people do breathing in meditations. So you divide the breathing into 3 parts, into 3 equal parts. One part is breathing in, one part is holding your breath, and one part is breathing out. When you breathe in, it is very important that you breathe in through your nose. When you breathe in through your nose, your blood vessels are relaxed, your heart is more relaxed, and it keeps your blood pressure down. It also means that you're not breathing in too fast, that your airways would collapse. If you are affected by coronavirus, the airways are restricted, and down in the lungs, all the tubes are tight, they have mucus in them. If you breathe in too quickly, the airway would collapse, they would tighten up, and you can't get the air in. So the way to do the breathing is like how they do it in meditation. You divide the breathing into 3 equal parts. So one part is breathing in, one part is hold your breath, and the other part is breathing out. When you breathe in, so to do that, you first sit up straight, keep your back straight. When you breathe in, always breathe in through the nose. Make sure that the air doesn't go in too quickly. If the air goes in too quickly, at this time, your your airways are not constricted, and the lung is filled with mucus. So if you breathe in too quickly, sometimes the airway can collapse and you cannot get a lot of air into your lungs. So when you breathe in through the nose, put your hand where the tummy is and try and bring air all the way down to the bottom of the lung. So when you do that, let the tummy go out. So let's do that. Breathe in through your nose, then hold your breath for maybe a count of 3, and then breathe out. When you breathe out, put your lips together, like blowing a candle or whistling. By doing this, you're creating a little bit of back pressure that keeps the airway open so you can get as much air out as possible. Doing this also helps to move the mucus out. So as you open up the bottom part of the lung, by taking deep breathing, it moves the mucus from the bottom of the lung up. So do that again, breathing through the nose, hold your breath, and breathe out. If you have done meditation for a long time, you can hold your breath, or your breathing can be a lot longer. You can hold your breath much longer. But at this time, if you're already having coronavirus, you're very short of breath, try and hold for maybe a count of 3. And if you're better, you can hold for a count of 5. Like breathe in, 1, 2, 3, hold, 1, 2, 3, breathe out, 1, 2, 3. So into 3 equal parts. So let's say that, breathe in, hold, breathe out. Breathe in, 1, 2, 3, hold, 1, 2, 3, breathe out, 1, 2, 3. As you get better, you can increase that to a count of 5. Breathe in, 1, 2, 3, 4, 5. Hold for a count of 5 and breathe out for a count of 5. After doing this for a while, you feel that the mucus start to come up, and at this time you can cough the mucus out. You can do some huffing also. Huffing is like this. When the mucus is already at the back of the throat, you can do a little bit of huffing to help. And then to help getting the mucus out. If you can feel some mucus at the back of the throat, you can start doing coughing. So you can do 1 cough or 2 cough. Now don't be afraid to cough. Coughing is a good way to get the mucus out, to keep the lung clear. If you can't get the mucus out, your lung gets filled up with mucus, you die. So isolate yourself, do the breathing exercises, and cough. If you feel exhausted or tired, rest for a while and then do the breathing exercise again. So breathing exercise, breathe in, hold, breathe out. Do that a few times, breathe in, hold, and a few times, and breathe out. Sometimes you can try and take a really deep breath and then hold for as long as possible, and then you breathe out with your lips together. Like. I can go longer, but breathe out. So by taking in a big breath, you open up all parts of the lung. The only way to move the mucus out is to open up the lung. If your lung is filled with, if your lung cannot be opened, you cannot move the mucus out. So you can do this every now and then, just one or two times, and then have a rest. So do that again. I'm not sick yet, so I can hold my breath much longer. If you're already sick, you probably can't take in as deep, cannot breathe in as deep, and you cannot hold your breath as much. Sometimes you can get too much oxygen in and you start to feel dizzy. If you feel dizzy, just relax, have a rest for a while, and then do the breathing, the pursed lip breathing, the slow breathing exercise again. Like breathe in, hold, breathe out. So ideally, you should be sitting up or standing up and do this maybe for a few minutes throughout the day. And then you do huffing and coughing, like if there's mucus behind the throat, try and cough it out. If your cough is still strong, then you can get the mucus out. If your cough is weak, sometimes you can, while coughing, you can support here and help pushing with the cough. So if you can keep the lung clear, keep the mucus out, then you have a better chance of survival. You can stop the heart rate go up, stop the blood pressure go up, stop the mucus coming out and clogging up your lung. Other than doing breathing exercise, breathing and cough exercises to help with your breathing muscles and help keeping your lungs clear, you can do massage and stretches for your breathing muscles. So the first breathing muscle is your diaphragm, which is at the where the ribs is, at the end of the ribs. You feel along here, if your diaphragm been overworked, it will be very painful. So wherever it hurt, you massage it. So along the base of the ribs on both sides. The other muscles are your intercostal muscles, the muscles between the ribs. So along the chest, if you've been breathing a lot, if your muscles are exhausted, the chest muscles will be very painful. So how do you know where to breathe? Where to massage? Wherever it hurt, that's where the problem is. So feel along the chest, it will be painful. The side, the muscles along the ribs on the side, these muscles will be very painful. Put your arm up if you can and feel along the side here. If you've been having to breathe through resistance, these muscles will be very painful. You can rub there. Your shoulders, the shoulders muscles will be also very painful because your body also uses the shoulder muscle to breathe. When it gets worse, you can't even lift your shoulder past 90 degrees because it's pulled so much. So your pec goes to your shoulder, that goes from here. You can massage your shoulder. If you can't do it yourself, get someone else to do it for you. If they make sure you don't infect them. Your neck muscles, the front of the neck as well as the back of the neck. So these muscles will be very painful. The idea is rub wherever it hurts. So wherever you have pain, those muscles are exhausted. They are tight. So when it's bad, like I said before, your neck will go into spasm and you can hardly move your neck. So you can hardly move your neck. So you can do gentle stretches. You can stretch and rub at the same time. So you can rub at the back of the neck, stretch it to where it's tight and rub it. Probably beyond the scope of this video to go through all the massage and stretches. Maybe I'll go into more details another time. The idea is rub wherever it hurts. So the neck muscles, chest muscles, shoulders, diaphragm, ribs, and the back, if you can reach, your lower back, along the side here. So these muscles have to pull the ribs down to open up your chest wall. Even along the front here, they have to pull your ribs down. Like I said before, if these muscles have to overwork, you wake up and you pick up a toothpick and your back goes into spasm. You can't even walk. So massage here, you can do stretches for the back. If your breathing muscles are working and strong, then you can cough. If you can cough, you can get the mucus out. Also, if you can get the mucus out, then you keep the lungs clear and you survive. If your breathing muscles become exhausted, they go into spasm, you can't breathe, you can't cough, you can't take a deep breath, you die. What else can you do to help with the breathing muscles? Now, if you have money, you can buy an oxygen concentrator machine. My parents have some heart problem, so I bought one for them. My in-laws also have some heart problem. I bought one for them. So what happens if you have a heart problem and you call the ambulance? The first thing they do is they give you oxygen. If you already have an oxygen machine at home, you put it on and it helps with getting oxygen in your system, so your breathing muscles don't have to work as much. And having oxygen can lower your blood pressure, which can sometimes prevent a heart attack and prevent having more mucus getting leaked, getting pushed out in your lung. So those machines I bought on eBay, about $200-300. It's a good investment if you can get it. Now, another thing that can affect your lung and your breathing muscles is your posture, especially if you slouch. Let's say you go into this posture. Now, because you're in so much pain and your muscles are all tightened up, this posture might be the most comfortable posture for you. However, when you slouch, you're compressing the chest, you're compressing your abdominal area, so you cannot take a deep breath. Most of the breathing are happening up here. So if you can't take a deep breath, you cannot move the mucus out. And if you cannot move the mucus out, then your lungs get clogged up and you go downhill from there. The same as when you're standing. Now, if your back is hurting and your neck is hurting, you might find it more comfortable to maybe go into this posture. However, if you do that, the muscles will tighten up even more. You cannot take a deep breath, so you have the same damaging effects. The lung get filled up, your muscles become even more tight, and you can't take a deep breath, you can't cough properly, and if you cannot get enough oxygen, you go downhill. Even if you recover, if you are in this position for a long time, when you recover, your back will be very sore, your neck will be very sore, and you will end up with a lot of pain. And because the lung is not opened up properly, you might get, even if you recover, you will get damage to your lungs. Because the fluid build up, mucus build up in the lung that's not cleared out, so when you recover, the lung get damaged. So keep your posture straight, stand with a straight back, straight neck. When you sit up straight so you can open up the chest wall more easily. You can bring air all the way down to the bottom of the lung to make sure that they don't get collapsed. If too much mucus build up, your lung just collapse. You can't breathe. So some people get the virus, and then after they recover, they get damage to the lung. The best way to avoid damage to the lung is to make sure your lungs are always clear. You bring air to all areas of the lung, and keeping good posture can help with that. Now, as I mentioned earlier, having blocked nose, sore throat, swollen tonsils, and blocked, like restricted airway along the throat can be dangerous, especially if you can't breathe through your nose and you go to sleep at night. Because if you breathe with your mouth open and the tongue falls to the back of the teeth, the throat, your airway will get blocked. Like if you have sleep apnea or snoring, if your airways get blocked, you can't get oxygen in, and then your heart rate goes up, your blood pressure go up, and then things can go downhill from there. So it is very important to keep your nose clear all the time. So what can you do? Well, like I said before, when you sleep, make sure you don't sleep flat down for a long time. If you sleep flat, your sinuses will get congested and your nose will be blocked. So just do what they do in hospital. Sleep up at an angle. So if you have a raised up bed, that's good. You can prop up with a few pillows. Sometimes you can get a bed wedge. So that's a bed wedge. You can sleep up at an angle. So that will help prevent having reflux and vomiting. And clog up your airway. Other things you can do: cough lollies. It's good to prevent, to clear up the nose and help prevent a sore throat. I use the sinus rinse with saline solution to help move out all the mucus, all the mucus in the nose. That's good. The steroid spray sometimes can be a bit dangerous. They tend to dry up the nose, and then all the mucus gets stuck. And then after a few days, the mucus build up, and you have the biggest blocked nose ever. So I found it's better to use the sinus rinse with the salty water. Apple cider vinegar is good to clear up the nose. What I do is I put some apple cider vinegar into a cup with hot water, and then I breathe in the steam. The apple cider vinegar, the steam will help with reduce the inflammation in the nose and help clear up the nose. Another thing is your sinuses will be congested, so you can do massage on the sinus. So massage along the side of the nose. Then how do you know where to massage? Normally where it's tight, it will be painful. So along the side of the nose, on both sides. Because you're free, you're not going to work, you're at home all day, so when you're free, rub the side of the nose wherever it hurts. You can smile and then rub alongside here. It will be very painful if your sinus is blocked. You can rub between the eyebrow, around here, and along the eyebrow. If it's blocked, it will be painful. So rub wherever it's painful. Up on the head, massage. Just do a few minutes for each area, 1 or 2 minutes throughout the day, so that the sinuses don't get blocked. Another thing you can do, if your nose gets blocked and you want to keep breathing through the nose, there's a trick. You can breathe out, get all the air out, and then hold your breath for as long as possible while shaking your head. Like, hold your breath, shake your head. Normally I do that, my nose gets cleared up. So just breathe out, hold your breath, shake your head, either up and down or sideways, and then your sinuses will open up and it will clear your nose. Remember to keep breathing through the nose all the time, throughout the day. If they are blocked, you have to unblock them with all these things: cough lollies, sinus rinse, apple cider vinegar, and do the hold the breath exercise to keep the nose clear. If you start breathing through the mouth, your mouth will get really dry and swollen and sore, in the throat, and then it clog up your airway and you can't breathe. You go to sleep at night, you have blockage in the airway, and things can go downhill. For the throat, your tonsils will be swollen. Again, cough lollies will help with the throat. I do gargle with apple cider vinegar, so put apple cider vinegar and honey, make it a little bit sweet, in warm water and gargle to help with the inflammation in the throat. I also drink apple cider vinegar with honey and warm water to help with hydration and reduce the inflammation in the body. Now your sinuses are inflamed, and at the front of the throat you have lymph nodes. These areas during this time they are swollen. The lymph node, how do you know if they're swollen? You touch the front of your neck and it will be very painful. You can massage the tonsil itself. If the tonsil is very swollen, it will block your airway. It will make the... So you can massage here to help reduce the inflammation in the tonsils. Front of the neck, just put a bit of pressure wherever you feel pain. Rub down. With the tonsil, you have to go up in here and put pressure and hold. Do that if you're game enough. It will be very painful. You don't have to. I do it myself, but it's very tricky. Rub the front to remove the blocked up lymph in this area. If your lymph nodes are all clogged up, they cannot kill the germs. So I do massage around there. There's massage along the collarbone to move the lymph out. Your eyes will be, there's a lot of pressure behind the eyes. So you might feel dizzy, and there's the eyes might be blurry. You can massage around the temple area. Just put some pressure. It will be very painful along the temple area. Massage along there, behind the ear. Because you're free at home, you're isolating yourself, so you have plenty of time to do massage here. Again, it's beyond the scope of this video to go into too much details, but massage the temple area, the sinus, so that you restore the blood to your eyes, stop your eyes from being blurry and tight behind the eye. Massage the front of the neck, around the collarbone area. You can stretch the neck back at the same time because it will be very tight, and help clear up the lymph in this area. It's also help reduce the inflammation in the tonsils. Now the next topic is vitamin C. Make sure you get plenty of vitamin C. Why is vitamin C important? Vitamin C is an antioxidant, so it's helped you neutralize the toxins in your body. It's an anti-inflammatory, so reduce the inflammation in your body. It's also helped to kill germs, like all the bacteria and viruses in the body. It helps. Vitamin C is normally used as a preservative, so it keeps food for a long time. It kills germs and it keeps food stay fresh for a long time. Another thing that vitamin C is good for is you need it to make collagen. Now, collagen is very important when you are sick, because as you get the coronavirus, your body depletes itself of vitamin C very quickly, so it makes your collagen weaker, and you need collagen for nearly all parts of your body. So it's in your joints, it's in the connective tissue, it's in your bones, in your muscles, in your skin, in your hair, in your nail, in your blood vessels, in your lungs. So say if you have collagen in your skin, you don't have the wrinkles and you look younger. In your bone, the calcium make the bone hard, but it makes it brittle, whereas the collagen make the bone flexible. So when you fall, if you don't have enough collagen, the bone just break in half. But if you have enough collagen in the bone, it just crack. Just like young kids, when they fall down, their bone don't break in half, it just have cracks in the bone. But in older people, they have less collagen, the bone just crack in half and you have broken bone. Collagen's in your blood vessels, so if you have a lot of collagen in the blood vessels, it's more flexible, so it's more elastic. It helps with moving the blood along easier, so the more collagen it is, the more it bounces and it keeps the blood pressure lower. Also, if your blood vessel is low in collagen, it gets damaged easily. So long time ago, people go sailing and they don't eat enough vitamin C. They ended up with having scurvy. So when you have scurvy, your bones are weakened, your blood vessels are not strong, so you start bleeding through your nose. You have blood nose. You start bleeding through your eyes. You lose your vision. You start bleeding through your mouth, bleeding in your internal organs. You have broken bones, and then you die. So that's scurvy. So when you have coronavirus, it also depletes your body of vitamin C very quickly. So with less vitamin C, your collagen is weaker, your blood vessel is weaker. So what happens if you have really high blood pressure, but your blood vessel is now weaker? So if it's really high, you start having blood nose. If there's a rupture of the blood vessels in the nose, if the blood pressure is very high and it ruptures an artery in your heart, you have a heart attack and you die. Your kidney have to filter a lot of blood. It has to remove the toxins in your body. So if the blood pressure is very high and the blood vessels are weak due to a lack of collagen and vitamin C, the blood vessels in the kidney can rupture. The kidney cannot filter toxins in your body, and you have kidney failure, and you die. If you have if the blood vessels in your liver get damaged, broken, you have bleeding in the liver cannot filter the toxins in your blood, you have liver failure, you die. If you have a rupture of an artery in your brain, you may have a stroke. If it's severe enough, the stroke can kill you and you die. If you have a rupture of an artery in your lungs, you start coughing out blood, or sometimes if it breaks the small little arteries in your lung, your mucus will be a bit pink. If there's a lot of blood inside the lung, you cannot get, there's less area for gas exchange, or you get too much blood in there, you die of drowning, it filled up the lung. So it's very important to keep your calcium, vitamin C level high to make sure that the blood vessels are strong, bones are strong, and you don't die of having ruptured blood vessels. It's also help with inflammation and help with removing toxins in your body. Another thing that you need vitamin C for is the tubes, the airway, the passages in the lung. It's like your blood vessels. If you have the collagen, then they stay strong. With less collagen, like in people with emphysema, the airways in the lung are not strong, so they collapse very easily. And they are not as elastic. So when that happens, if you breathe in too quickly, the airway just collapses. If you breathe out too quickly, like if you cough, the airway just closed, you cannot cough out the mucus, and if the mucus build up in the lung, you die. So a lack of vitamin C can also affect the structure of the airway of the lung, so make sure you have enough of it. So what type of vitamin C? So get the tablets. Those you might need to take a few times a day to make sure it's always in your system. How much to take? Some people take larger dose, some people just take the recommended dose. You do your own research. Juices are good. I drink lemon with honey and water. Sometimes I squeeze some oranges, put in water and a little bit of honey and drink it. The juices that you buy in the shop is not the same. Sometimes they have been heated up so that they don't go off, and when you heat something up, you destroy the vitamin C. So it's not the same. It's better if you squeeze the juice yourself at home. Okay, and collagen, you can eat collagen in your food. The best thing to eat is bone broth. So if you're Vietnamese, you go to Vietnamese restaurant and you eat noodle soup phở, that's bone broth. It helps you build up your collagen, so your blood vessels doesn't rupture when your blood pressure go up, and your lungs doesn't get collapsed easily. You can cook the bone broth yourself at home. So you can get chicken bone, pork bone, beef, fish head. I like to cook it for 24 hours to 48 hours to get all the collagen out, and then I drink that if you are sick and maybe a little bit every day to make sure your collagen level is sustained. And so if you have enough vitamin C, enough collagen, your blood vessels stay strong, your lung stays strong, you get rid of toxins in your body quickly. Yeah, that would be good to help you fight this virus. What about water? Now, as you when you get this virus, you have diarrhea, you vomit, so you lose a lot of water. Having enough water is very important. If you have a fever and you are all dried up, it's very easy for you to be overheated. So if you have enough water, the body can use water. When you sweat, you can avoid getting too hot. When you have enough water, the mucus in your lung is not too dry, so they are more moist. If they are moist, not too dry, you can cough the mucus out easily, so it doesn't get built up inside the lung. Your body also uses water to control blood pressure. If you have very little water, that means the blood pressure will have to be higher to push to all parts of your body. So if you are dehydrated, your blood pressure will be high. If your blood pressure is high, that means big problem. You can have a rupture in the blood vessel, in the heart, in the lung, kidney, liver, brain, and then you die. So you don't want to be dehydrated and your blood pressure go up and dangerous, you die. So that's all I want to say in this video. Just to sum up, most important thing is keep your lung clear. So that means getting up. Don't lie down all the time. If you lie down, make sure you're raised up in a recliner or in a raised up bed. Do breathing exercises, keep your lung clear, cough, huffing, don't be afraid to cough, get as much mucus out as possible. The sooner you get to treat the symptoms, the easier it's become. Don't wait until it's too late. So if you start getting a blocked nose, clear up your nose. If you start getting sore throat, do things so that it doesn't get too inflamed. Get vitamin C, drink plenty of water, eat plenty of fruit for vitamin C. If you haven't tried bone broth or pho, get some. Keep your collagen level up, so that keeps your blood vessels strong and your lungs strong. So also your breathing muscles are important. Keep good posture, do stretches, do massage. make sure that they are strong, that you can cough and move the mucus out easily. So anyway, so if you can somehow keep yourself fit enough and keep your lung clear for maybe 2 weeks, then your body defense will take over, and you will recover, and you join the maybe 96%, 97% group of the people who will survive. So that's all. I hope the video is helpful. So write some comments if you agree or disagree with something. I'm sure I've missed many things, and there are many things I didn't go into too much details, and let's hope we all survive this thing, and I'll see you on the other side. Okay, bye.